As physicians, whenever patients come in to office visits, we usually sit down with them and we'll review with them how many seizures they've had since their last visit. And based on understanding of how many seizures they've had, we use this to better make a judgment about whether or not they've responded to treatment or whether or not we need to change treatments. But a major clinical challenge in this relates to the fact that oftentimes when patients have fluctuations in their seizure frequencies, this could be caused by natural variations, natural variability in their actual epilepsy disease course, or it could also be caused by a worsening or improvement in their actual seizure risk. And one can see that if misinterpreted, that this could potentially lead to either unnecessary or potentially even harmful treatment adjustments. Diaries can be really useful across the lifespan. A lot of it can be very useful if you're patients where they have a lot of seizures or they have a very complex natural history, in which case we can better understand the patterns in their seizures and what sorts of triggers may be precipitating them and what is the rhythmicity of their underlying seizure risk. But I think even beyond that, that can be helpful across the lifespan in the sense that oftentimes unpredictability affects a lot of people with epilepsy, and even beyond the injuries that can possibly happen, oftentimes it can lead to like a feeling of helplessness, and keeping a good seizure diary can often help you to kind of understand your own epilepsy and understand when are the periods where you're at high risk versus low risk, and that aspect can be helpful to many people. Patients can record their seizures, and they record when they have specific triggers or things that they think may have precipitated that, and we use that data to estimate what their underlying seizure risk is and to provide a model that can determine when changes in their seizure frequency are caused by actual improvements or worsening in seizure risk versus secondary just to natural variability.